Yeah, that's awesome.
Yeah.
Because we even have these conversations with employers all the time. And, since the passage of the ACA, I think employers in the back of their minds are waiting for the ACA to go away. But it's like, come on, guys. I don't think it's going away anytime soon. And so we can either continue to wait for politics to shift, or you can start to learn and educate yourself on what strategies that are available today and what action you can take today.
Yeah.
Maybe you can speak to that a little bit more, especially if people, Skip and I always talk about, we're giving our employees unlimited credit cards in the form of health insurance ID card. They don't know cost, they don't know quality. And a lot of times, they're trained to start with your primary care physician. Your primary care physician will refer you to a specialist. The specialist will then, the whole rigmarole. And a lot of times, these health systems have built their own little vertically integrated models to capture that patient, whether it's through an urgent care, ER, or a primary care, to then funnel them up to, the bigger things like orthopedics. And maybe you can speak to cost and quality are probably not equal when surgery is being performed at an OrthoForum Value Network provider versus a health system. Yeah, it's not like it's not like taking your car to Jiffy Lube. If they they do maintenance on your car and you drive away and it's not fixed, you don't take it back and then they keep charging you. And that's exactly what happens in healthcare. I mean, if things don't go right, obviously the meter's still ticking. And so that's why it's super important to, right care, right price, right time.
So from a, I'm going to kind of shift gears kind of on the platform side here, just so our listeners are, understanding, excuse the pun, the value that you are bringing to the table. I mean, you have massive scale here. So you have the horsepower with negotiation, you have the horsepower with the quality and outcomes, which is phenomenal. But speaking to the infrastructure side here, a couple of things. One is, do you rely on the broker community to go out to try to share the good news? And I think that's the other thing about what we're doing in the community connected health space is that we have providers and pharmacists and DPC. Thanks for bringing them up, Scott. We're all working together in this. But if I'm a broker and coming out of my black box here of trying to say, hey, I need to do something different, how does one get connected with OrthoForum? Because OrthoForum Value Network works with several different platforms, right? Through TPAs, through the broker community, through the DPC, so that we've got, friends with the program type of thing where we have the DPs referring to you. Can you maybe speak to that again? Just looking more of just the fundamentals here, because you guys are a huge piece of the puzzle here. But what if we have a TPA in a certain market? There are multiple platforms that you guys connect to. Does that make sense how I'm putting it out there? Because I'm a little eclectic sometimes, as you can tell. It's happening every day here. I'll tell you that.
Yeah. Yeah, it's frustrating sometimes because, we talk to a lot of employers and, we've even answered a few RFPs lately. And the amount of questions that we get on, like, how do you educate our employees? What can you provide? Are there platforms? Are there documents? Are there one-on-one meetings? All these educational type things. But at the end of the day, sometimes I feel like employees want to choose easy and just go to the hospital down the road. And, it's super important to just educate the everyday American that, cost and quality is all across the board, across the United States. And don't go to Facebook and just post on a thread, who's a good orthopedic surgeon in my area? Find those data sources. And, we've got nurse navigators in a lot of our plans that, have that information at the tips of their fingers.